Hello, everybody. My name is Regan Archibald, and the reason I do these videos and the reason we have this show is because a lot of people are unhealthy, and I don't want you to be one of them. I'm the founder of East West Health, which is an age reversal company that allows you to become unreasonably healthy in the shortest amount of time without sacrificing the most enjoyable parts of life. Your time is your most valuable resource that you have, and so I want to give you easy ways to stay healthy so that you make your next decade your best decade. And by the way, if you enjoy the show, please leave us a review and we will love you forever. And please enjoy the show. Hey everybody, welcome to the show today. Today's going to be really interesting and stimulating, and hopefully gets you serious about two of the most important organs in your body, your brain and your heart. And today I've got Tucker Beatles as my collaborative partner here. He's our East-West program designer and just a great leader, someone who's worked in the fitness and health industry. Tucker, thanks for being my co-host today.
Happy to be here. Thanks, Regan. I'm excited to dive into all the cool stuff we've got for you today.
Yeah. Now, how many people who are listening today have had a heart attack or coronary arterial disease or know of somebody who has? And Tucker, do you have anyone in your family that's had a heart attack, or anyone close to you, or friends, family, anyone?
Yeah, grandparents, aunts and uncles. There's a handful, and not just heart attacks, but strokes too. Yeah,
and they can be devastating, because the reason I want to bring this up is because the healthier your heart is in general, the healthier your brain's going to be. And we've got our peptide masterclass coming up on Friday very soon, and it's all going to be peptides on heart and brain. And so today will be an overview of that, because the masterclass is a deep dive, and you've been on our masterclasses. They're pretty darn nerdy, but man, we get some distance covered, don't we?
Oh yeah. A lot of the details that you don't get in a short overview. Very, very detailed, very informative.
And so, yes, jump on there. And I think one of the interesting things is, you look at, you had heart attack, stroke, and we have to ask ourselves, like, what if we had better knowledge and we could have helped, we could have had a conversation with those individuals before they had the event? And what if there's a way we could circumvent that? And that's what this is about today. But some of the major signs of having a heart attack, these are the things you want to look at immediately and go to the emergency room. It is too late at this time, because if you have like pressure, if you have that cold sweat, the pain radiating down your left arm, these can all be signs of having a heart attack. If you have shortness of breath, abdominal pain, even heartburn and indigestion. I'm not sure if you're aware of that, but some people mistake that as just being like they get nauseated, they get heartburn, indigestion, abdominal pain, and they're like, oh, I must have eaten something. But in certain cases, that can actually be an early sign of a heart attack coming on. So it's an early warning. And even in women, women are now having more and more heart attacks, and some of their symptoms can be even more subtle. So if you're a female, your main symptoms, according to the Cleveland Clinic, are going to be unusual fatigue, sweating and shortness of breath, and then pain that radiates from the chest to the jaw, or the back and neck. But the biggest thing we see is women can have anxiety. They can have kind of panic attack symptoms. So if you're, if you're typically running where you've got heart palpitations, you get dizziness, vertigo, fatigue, you have trembling. These are things that you should be aware of, because they can be warning signs. Because warning signs, according to the Mayo Clinic, these can come up weeks, days, or even hours in advance of a heart attack. And so the faster you can get on it, the better. Tucker, any ideas of how many people die every year from heart disease?
I don't know the number, but I do know it's at least from what I've learned in the past that it's the leading cause of death in the US.
Yeah, and it's somewhere in the ballpark of about 600 and you know um, 50,000 people die every year of a heart attack, and
Wow.
in coronary arterial disease or heart disease, 1 in every 7 deaths in the United States are from heart disease alone. And so that's a phenomenal number, and it can be avoided. And so even in women, it's the number one killer in women. And the reason I'm keep bringing this up is because a lot of us we just think of men as the ones having heart attacks, and it's just not true. And we're seeing people younger and younger. I remember a patient who was 32 years old, came into the clinic, and he said, I want to get help to reverse my coronary arterial disease. And I looked at him. I said, well, you're 32. And he said, oh yeah, I've already had a heart attack. I don't want another one. My family genetics are horrible, and I'm stressed out of my mind. And so we got him on a program. And this was about 5 years ago. And when we first ran his blood work, his homocysteine was elevated, his C-reactive protein was up, his ferritin was up. We found out he had a massive infection. And we actually ended up sending him to Dr. Peterson, who a great dentist. If any of you need a great dentist, go see Dr. Peterson at the dental studio. And he actually had an infection, a root canal that was not sealed properly. And that was a big contributing factor for his early heart attack. So brush your teeth is one of the first things you can do to help prevent a heart attack. Seems kind of weird, doesn't it?
Yeah, that's a simple step, but it's very important for many reasons, I would say.
What would you say the most important reason is? Is it because you don't like the way bad breath smells, Tucker? Or?
That's typically it. Yeah. Brushing your teeth has all kinds of benefits, everybody, including preventing heart attacks.
Yes. And if you want your spouse to kiss you or your date, then it actually helps. Is what I've found.
Case study there for you.
There's a case study. And Tucker, you worked with the Atlanta Falcons. You've worked as a trainer. Did you ever see any of the athletes you work with at a young age have a heart attack?
I didn't know. Definitely not something that is very common in that realm. I think very unusual if that were to happen to those athletes.
Yeah, very unusual. And I think that's where it's been such a shock to the sporting world. I think our heart attacks and sudden death on the field is up like 3,800%. And a lot of people are pointing, at the association with the COVID vaccine. So this can even now we're realizing that first of all, the endothelial cells are these cells that line all the blood vessels in your body. And the COVID vaccine seems to irritate those little cells, those endothelial cells. And when the endothelial cells are aggravated and inflammatory, then that's where you start getting either blockages or you can get clots. This is where we're seeing a lot of the strokes that come from it. And so this RNA type vaccine, a lot of the research, and I've actually seen peer-reviewed journals, this isn't just like, Dr. Mercola or, some whistleblower out there. This is, legitimate peer-reviewed studies that are now showing that there's higher prevalence of heart disease with those vaccinated. So it's something to look at. We don't know all the data yet, but I certainly have seen changes in people's labs. And so if you are looking at the main things, there's 4 major categories that we look at when it comes to heart disease or any other type of disease that shows up in your body. Number 1, look for physical traumas. And so if you've had injuries, physical injuries, that can impact the stress levels in your body and cause pain. That can impact your heart. And that can cause a rise in a hormone called aldosterone that can cause hypertension, because hypertension is one of those killers that's pretty well silent. And Tucker, you've seen where we've had some of our patients come in with high blood pressure and we treat them and then the blood pressure comes down. What's been your experience with that and seeing some of those cases?
A lot of times they're bewildered. It's like, oh, I didn't know that was possible. I didn't know it could happen that quickly. You hear that quite a bit. But a lot of relief. You can tell that it's almost like they just drop 10 pounds of pressure on their shoulders from just fear of what that could lead to.
Yeah, because what a lot of people don't realize is that hypertension, that a lot of times it is triggered by a chronic injury, chronic pain. So you want to take care of that issue. But whenever your blood pressure is unregulated and it's too high, it starts to diminish your kidney function. So suddenly your electrolytes, and we just think it's hypertension, it's no big deal, you don't even know it. But what you're doing is it's like running really poor gasoline in your car, because the gasoline can't get burned efficiently. And what happens when aldosterone is elevated, we get more epinephrine, more norepinephrine, adrenaline release, and then we get more vasoconstriction. And then with that vasoconstriction, we get more cortisol and blood sugar dysregulation. So there's a bunch of things that happen with hypertension. And the end result is where your GFR in your kidneys starts dropping, your creatinine levels start going higher, and you can't clear all the toxic waste out of your body. So, so heart health is so critical on so many levels. And one of the first things you want to do is check your blood pressure. That's a very easy marker to look at. And then also you want to be looking at your lipid profile. You want to look at your cardiovascular profile and your labs. But there's another test that we're introducing in the clinic called Clearly. And Clearly is one of those tests that dives deeper into the cardiovascular factors, and it shows some of the methylation of the DNA. It can also show where initial problem spots can be. And then the other test that we're doing is called metabolomics. And metabolomics is interesting because metabolomics will show you where the oxidative stress is coming from. Tucker, have you seen those metabolomics panels?
Yeah, the results.
Yeah, the results. Yeah, they're pretty interesting because, I look at it as, one of our core mantras at East West is we don't want to leave any stone unturned. And we have a policy where there's no death by surprise, no death by neglect. And so that means we've got to run the correct tests. And the oxidative stress is interesting because it shows you what the precipitative factors are that are causing some of the damage in the arteries. And it's, if you think of oxidizing, you think of metal that oxidizes, you start to see it rust and it changes, there's some electrolysis going on there. That's the same thing. We're getting essentially a bronzing in our blood vessels. But Tucker, if you looked at what the number one, probably worst thing you could do for your blood vessels, any ideas of what that might be?
Worst thing you could do for your blood vessels? I'm going to go out on a limb and guess sugar.
That, you nailed it.
Yeah.
Yes.
Nice.
Well done. Are you familiar with what age is, AGE, in blood vessels from sugar?
No, I'm not. But I do know that the sugar molecule, and please correct me if I'm wrong, but it's sharp. When you break it down to like really how small it can be, it can damage the inside of the vessels as it's sliding through there.
You got it. So it's, and part of that is when you have a spike of blood sugar, a surge of it, it's, you're just basically like pulling sandpaper through the blood vessels. But the other thing that you want to look at is age stands for advanced glycation end products. And so age is what speeds up the oxidative stress. And so for years, I mean, you go back to World War II, you go back to just after that World War II, when Eisenhower, who was a great war general, I mean, he was the one that took us into the shores of Normandy, and we put all our eggs in that basket. And he became president of the United States, but he had a heart attack, massive heart attack when he was in office. And all of the policies around heart disease changed in the United States. So I'll give everyone just a little historical perspective of this. And so what they did is he sent out all his key advisors, one of those being Ansel Keys. And Ansel Keys went to a conference, and they advocated a low-fat diet at that conference for cardiovascular health. And they cited one kind of nuanced study that no one really backed up, and they didn't, actually review it properly. And he came back and put Dwight Eisenhower on basically a fat-free diet, no fat in his diet whatsoever. He had to eat dry toast. He could only have one egg a week. And Dwight Eisenhower ended up not only getting sicker, but he had Crohn's disease by the time he left office. And so, but the damage was already done. We rolled out this big fat-free movement in the United States because in the 50s and 60s, that was a heyday for us economically. No one could touch the United States. I mean, if you were born during that time, you were guaranteed a high-paying job with a pension, and all you had to do is get signed on with one of the big corporations. And it was a really nice time in American history. But the fat-free movement was there to circumvent the fact that we had diseases of affluence because people were overeating, indulging in sugars and things like that, probably eating too much fat too. But the damage had already been done, and it's still, you still walk the aisles of the grocery store, and how many items are fat-free now?
Oh, there's a lot.
Yeah,
Yeah.
it's still there.
Mm-hmm.
Yeah, and unfortunately, the amount of heart disease goes up every year, and so one of the things that the American Heart Association did in 2017 is they created this new category of hypertension called pre-hypertension. And now if you're hovering at 130 over 80 even, then you're considered to be pre-hypertensive, and you can get medication earlier and earlier. And instead of treating the cause, which is oxidative stress, it's these advanced glycation end products from sugar. It's the pain levels that we don't resolve. It's the aldosterone dysfunction. We throw a Band-Aid on it in the form of a medication. And in that same year, in 2017, the CEO of the American Heart Disease Association had a heart attack himself. So I thought it was kind of ironic.
Very.
So we do need to be careful about where we're getting our information, because the misinformation is pretty massive out there. And so one of the things that we're doing, and we're trying to look at things differently from a root cause perspective. And I think that's one of the big differences. And so what we'll do now is we're going to shift gears just a little bit, and we'll talk about some of the ways that you can use novel therapies to possibly keep your cardiovascular system much healthier for the long run. And then we're going to talk about some different peptides that you can use to create harmony between your brain and your heart.
Real quick, I hope you're enjoying the show, but if you're somebody who wants to take your health to the next level, maybe you're an entrepreneur and you realize that you are your only impediment to growth. Maybe you have kids that you're chasing around or grandkids. Maybe your knees are starting to ache. You're starting to notice that aging is catching up. We'll schedule an appointment with one of our health ascension specialists so that we can get the right labs ran for you. And then my team and I can review those labs, meet with you, and get you a personalized peptide protocol put together. And that will help you recover your health, feel, look, and perform your best no matter what age you are. All you need to do is text or call us at 801-582-2011. I hope you're enjoying the show, and I can't wait to talk to you soon.
The first trauma we talked about was the trauma of physical trauma, which is like pain and things like that. The second one is emotional stress. And that's, you could only imagine what Dwight Eisenhower must have felt, being, general of the army, great purpose. And now he's got all the complexities of a president. So, and then the third one, beyond the emotional stressors, is stressors from infection. And we talked about seeing a dentist, making sure that you brush your teeth. One of the reasons I wanted Tucker on today is so I could actually have him shame you for not brushing your teeth. So every time you're in the office, Tucker is going to do a breath smell. Is that how you're doing your testing?
Yeah, before they come in the front door, I stand at the door all day and just smell breath, just to make sure.
That would be like the world's worst job.
Yeah.
The Hawaiian culture, they used to greet each other where they'd go nose to nose and they would inhale each other's breath. That's the ha, like aloha. Ha is breath, and so that's like the breath of life, and so that's how they greet each other. And if you read any of Weston Price's work on some of the Aborigines, even the Hawaiian diet, like they had different jaw structures, their teeth had more space, they didn't need braces because they're eating whole foods that, a variety of fish and meats and vegetables, and they did great. So I imagine their breath wasn't that stinky, or it probably wouldn't have, they were doing that for, a couple thousand years. So yeah, but Tucker is going to do that. So, make sure you brush your teeth before you come in.
Please.
Yes, and that's the infection category. You can also, you can have a massive heart attack just by going septic. So if you have like a UTI that's unresolved, if you end up with, chronic kidney stones, that can really impact your cardiovascular health. So, making sure you're doing a stool test once a year, that's really important. And then the fourth thing is toxicity. And that's where metabolomics, that's where the Clearly test, these are really important because the toxic burden and the chemicals make a big difference as far as how the health is of our blood vessels. So let's move on and talk peptides, shall we?
Absolutely.
So some of the cool things we've introduced in the clinic just recently are these cool bioregulator peptides. And Tucker, we had a really fun training last week on the bioregulators. Can you kind of summarize what bioregulators are?
I think that was the day I was unavailable for the training.
Sorry. Okay, let me summarize for you. Sorry, Tucker.
No,
Tucker's like, ask me anything except what bioregulators are.
But Regan would give a great explanation, better than I would be able to.
So bioregulators are essentially these peptide amino acid structures that are typically 4 amino acid chains or fewer, and they're folded in a specific pattern. And these peptides were heavily studied since the early 80s by Dr. Kavasin, who many of you have heard me talk about him in the past with his discovery of epitalon or epitalon. But he started using these bioregulators because he found that they were super advantageous for organ systems. So he noticed in studying, animal models that every organ had a very specific peptide that it would excrete. And so he discovered that by giving somebody a peptide for the thyroid gland, for example, the thyroid would exhibit these releases of peptides that could upregulate the thyroid if you're hypothyroid, or it would downregulate it if you're hyperthyroid. And then he found the same thing for the pancreas and for the heart and for the blood vessels even. And so now we have the peptide. We've got one of our bioregulators called Lady. And Lady is interesting because it's got peptides for the vessels, the blood vessels. So that's really important because if you have hormonal issues, like if your estrogen levels aren't healthy as a female, that can trigger cardiovascular damage. And so that's in there. Then there's another peptide for the thyroid, because we know that the thyroid helps regulate and stabilize the menstrual cycle. And then we have the ovarian peptides. And so if anyone has like menstrual cramps, this can be a game changer. Did you hear Misha's story on using Lady?
Yeah, she said it was wonderful.
Yeah, because she typically has kind of 5 days that aren't very comfortable during her menstrual cycle. And I asked her if I could share this, by the way. So I'm not, this is not HIPAA violation. So, but what she noticed is that she took the Lady peptides, and instantly her menstrual cramps went away. Her brain started working again, because all these bioregulators are doing is they're allowing your organs to start expressing the release of these peptides. So a bioregulator will go in and turn on a gene that's not functioning properly, or turn off the disease patterns. And so we use a lot of these, like KPV. That's another bioregulator, GHK copper, which is in our new, and by the way, if you guys are looking for some great skin lotion with peptides, the new GHK copper one is amazing. But all GHK copper is doing is turning on the genes to express stem cells in your skin. So it's, it's kind of like the conductor of the symphony. It just turns on things that need to be turned on. It's no different than like a adaptogenic herb, where you can downregulate a system that's over functioning, and then upregulate a system that's underperforming. So that's bioregulators, and there's about 21 of them, 21 different peptides. One of my favorites for heart health, besides the vessels, is the nitric oxide. So nitric oxide is one of the best ways to have a healthy cardiovascular system, because not only does it activate the heart, but it also activates the brain, because when you have healthy nitric oxide levels, you're going to get a better release of different neurotransmitters like dopamine, serotonin. But on the flip side, here's the interesting thing is oxytocin and nitric oxide are, they're intertwined. And so Tucker loves a peptide that we use called the IZN. And this is a good one because it's got Sananga in it. It's got peppermint oil, which, yes, it does burn a little bit for about a minute, and it's got oxytocin in it. And so what's your experience like when you use the Zen Eye, these eye drops?
It clears my eyes, it seems, and you put it mildly, it burns for about a minute, but after that, my eyes feel very refreshed. It's like when you first wake up in the morning, your eyes feel a little tired, and after you get some sunlight in there, maybe some coffee, whatever it may be, that you're wide awake again, and it's kind of like that reset for your eyes for me.
Yeah, I notice when I look at the screen, I'll do the eye drops in the morning before my workout, because it increases vagal tone. So your sympathetic nervous system and parasympathetic, it balances it out. So this is a shortcut for improving your heart rate variability, or the way that your brain and your heart are connected. It's an easy way. And I was actually just on the phone with Dr. Lawrence, who formulated this out of Florida at his Madozen company. Brilliant doctor. But if you do this before you work out, you can push just a little bit harder. And then as I'm looking at the screen throughout the day, I'll use these eye drops in the afternoon. And it's just, like you said, Tucker, it's a refresh. Because your eyes start to get sleepy looking at blue lights all day. And yes, I have my blue light blockers, and I'll wear these off and on. But yeah, the eye drops do a world of good. So there's oxytocin in them. And here's the interesting thing that happens is when you have oxytocin that gets released, you produce more nitric oxide. And so your blood vessels, they dilate and they open up, and you get better circulation, better cardiac flow. And the nitric oxide is one of the most powerful ways that you can improve circulation in your body. And then it's vitamin C that helps protect the blood vessels. And our bodies don't make vitamin C on its own. And so the place where we store it is in the adrenal glands and kidneys. And so if people have higher stress, or if you're someone who's a type A, or you push yourself a lot, or you're constantly on the go, your adrenal glands are going to start burning out your vitamin C. So make sure you have plenty of vitamin C stores, because that helps with the nitric oxide. And then the more things you can do to stimulate oxytocin, the better. And so, Tucker, can you think of any easy ways that people get a nice oxytocin dump?
Are you thinking like cold showers, cold bath, things like that? Yeah,
that's it. Yep, that puts your body at ease. And one thing that you may want to do is you're smelling people's breath as they come into the door. You're doing your aloha. You could give them a big old hug.
Heart-to-heart hug, right?
Heart-to-heart hug. And, you know, it needs, I can't remember the seconds. It needs to be like 5 seconds. You remember that?
Andy talked to me about it the other day. I wanted to say it was in the teens. It might have been like 13.
Yeah, I think, you know, we could ask ChatGPT and figure that one out. But I think just hugging is great. Even a good handshake, even looking at someone in the eyes and smiling, you're going to get oxytocin that gets released. And so it's really important, because that oxytocin, and this is what I see in people who've had heart attacks, is they get to a stage of life where they feel stressed, or they feel constricted. And that thing happens from a physiological perspective. So, so the nitric oxide, these little peptides can be amazing. The other great thing for the heart is the sarcotropin IPA. And sarcotropin, if you think about what happens is as we age, as our blood vessels get really brittle, and as our blood vessels get brittle, things start to clot. Or we just lose the circulation of the muscles, and then muscle starts getting replaced by fat. And sarcotropin, it made it through the FDA clinical trials a few years ago for sarcopenia directly. And it's got growth hormone releasing peptide 2, growth hormone releasing peptide 6. It also has ipamorelin in there, which helps. It's a somatostatin inhibitor, so you get a better influx of growth hormone. It's got your vitamin K2. So vitamin K2 is one of the, with D3, with vitamin D3 and K2 are one of the best ways you can keep your arteries clean. Ideally, don't take D3 unless you've got it combined with K2. And using calcium supplements, unless it's calcium lactate, which is an easier enzymatic process to break down, I'm not a fan of that. And calcium D-glucarate is a totally different molecule than like calcium carbonate, because some of the calcium supplements can actually jam up your arteries. So be careful with those. The other thing sarcotropin has is L-leucine, L-citrulline. It's got DMAO for the brain, and then it also has GABA. So it helps relax things, and the more GABA you have, the better nitric oxide production you're going to get. So there's some very simple ways you can really improve your heart health. Once again, it starts by having the right mindset of how can I take care of my body from the 4 stressors? How can I alleviate any physical pain that I've got? How can I get rid of the emotional stress and trauma? And we gave you a couple ideas, you know, give people hugs, shake their hands, smile more, take yourself a little less seriously. The third thing is get rid of the infections. You know, the teeth are the biggest area. I can't emphasize that enough. Find a great biological dentist. We mentioned Dr. Peterson. I know there's other great ones there. In American Fork, there's Dr. Michelle Jorgensen as well, both members here at the clinic. And then the other thing that you want to look at is the toxicity. And so toxicity, yes, it can be in foods. It's the sugars that we eat. It's the chemicals we're exposed to, the oxidative stress, the burden on the mitochondria. All these things are really important when it comes to heart health. And so, so Tucker, what was your takeaway from the conversation today?
Outside of my new job responsibility of smelling everyone's breath, I would say my big takeaway would be the teeth. It's interesting that an infection in your mouth would potentially lead to cardiovascular issues and heart attacks. That's interesting.
Yeah. Yeah. And I think that's a big takeaway is yeah, brush, floss your teeth. Even better, we have the mouth drops now.
Focusing.
The Boca-Zen, thank you. The Boca-Zen is so powerful because what it is it's oregano, it's clove, there's cinnamon, there's cardamom, and then there's oxytocin. And you swish that around in your mouth. It's antimicrobial. It gives you great breath. And that's what Tucker will have at the front door as well. Oh, you didn't pass the test. Let's just, but yeah, those are great ways. Even doing oil pulling with like, coconut oil or avocado oil works really well to clean the mouth. And then one of the things Dr. Peterson has his patients do is take a swab and put some peppermint oil and spearmint oil and clean your teeth. So literally scrub your teeth with a little gauze pad. And that makes a big difference. And then use a water pick. I love my water pick. It's crazy when you floss, you brush, and you think you got your mouth all clean, and then you use a water pick and you still have like little salad fragments that come out. So yeah, it's a awesome invention. So
take care of your oral hygiene, everybody.
Yeah, really important. Well, this has been awesome. And for those of you who are ready to take your heart health to the next level, a couple things that I would recommend doing on a medical side is make sure you're getting your blood labs ran often. And if you don't have any recent labs, give us a call and we'll get your labs ran to see if there's any surprises. And then use some of the therapies we talked about today. There's great peptides out there, so many more that we didn't cover. We're going to be covering this in the master class. So look for episodes. We'll record some of that, but then if you jump into the master class, you're gonna love it. So Tucker, what's the best way people can get in touch with you to get blood labs ran or get set up with the master class?
Yeah, so you have a couple options. To get directly to me, you can email me at tucker@acueastwest.com, or you can just call the clinic or text the clinic and request me, and they can get you right over to me. Our whole team is able to help you with those things, but if you want to talk to me directly, I wouldn't blame you. You can just ask them to get you over to me. And if you don't have the number for the clinic, it's 801-582-2011. So give us a call and let's run some blood labs and see what we need to see.
Awesome. Well, like Benjamin Franklin said, an ounce of prevention is better than a pound of cure. So with heart disease, there's no better way of protecting your heart and your brain by getting it taken care of as early as possible. So Tucker, really appreciate you being on today, and thanks for everything you do at East West. We all appreciate you, and have fun with your new responsibility of smelling everyone's breath.
Thanks, Regan. I appreciate it. And no, seriously, I mean it. Thank you. Thanks for having me on.
You got it. Take care, everybody. We'll see you same time, same place next week. And don't forget to brush your teeth.